Would love to start by just doing some intros around the room with the panel. Oliver, thank you so much for joining us. I'd love to maybe just open the floor to have you tell us a little bit more about yourself and what you do over at Mate Fertility.
Cool. Hi, everyone. My name is Oliver Bogner, and I'm the CEO and co-founder of Mate Fertility. We're a next generation chain of fertility clinics trying to make fertility care more affordable and more accessible. We're opening up fertility clinics all across the country. We just opened up our first wholly branded clinic in Oklahoma City about 100 days ago, and we're in the middle of opening 25 clinics up and down California.
Awesome. Thank you, Oliver. And I think next we'll go over to Florence. Same thing, if you want to give us a quick, brief intro.
Sure. Thank you very much, India. I am Florence Comite. I'm CEO and founder of a startup called ScaleHealth, which scales a unique approach to healthcare that I started over 2 decades ago, called the Comite Center for Precision Medicine and Health, which takes people's health story and marries it to precision data to basically revolutionize healthcare in terms of predicting disease and reversing aging. And we hope to make it available globally. So we have proof of concept from the center, which is located both in Manhattan and in Silicon Valley, where I am right now. So I'm thrilled to join and I'm excited to be here.
Awesome. Thank you, Florence. Glad to have you as well. Thanks for making the time.
Yeah.
I think last but not least, we have Lee O'Donovan on the line from Vessel, who we plugged earlier in today's event with their coupon code. Lee, if you'd like to do the same and maybe just share some information about yourself and what you do over at Vessel Health.
Great. Thanks, India. Hi to everyone. Glad to be here. So I've been with Vessel about 2 and a bit years. Vessel is a urinalysis test card. That within about 3.5 to 4 minutes you pee on the card and scan the card with an app on your phone, and it gives you a whole bunch of biomarkers like magnesium, cortisol, vitamins, ketones, hydration, etc. And yeah, interested in sharing a bit more about what we've gone through in the last 18 months. It's been a super interesting time, but one that I think we've learned from and come out better.
Awesome. Thank you, Lee, as well, for jumping in. I know we want to go ahead and get started. Sarah, if you are online and can hear this and want to jump in, please feel free to take the mic back from me. But just to get things started here, maybe we'll start with you, Oliver, to get us thinking about this question, and then would love to hear from the other panelists as well. But what trends have you seen over quarantine that have really affected your business significantly?
Yeah, so fertility is something that has gotten a lot of attention during the pandemic. I think we went into the pandemic with lots of media talking about that it was going to be a baby boom. In fact, it was quite the baby bust. Birth rates have definitely slowed, and we're seeing that kind of tailwind, really kind of start going right now, where patients are just kind of increasingly coming to us asking about fertility preservation services, IVF, and everything else that we offer to help young couples create families.
Awesome. Sarah, I think you're back with us. We're just talking about trends that have affected each startup's business over quarantine. We started with Oliver, but feel free to take the mic back away. Seems like you've got your signal figured out and you can continue from here.
Yeah, no, I just gave up on my computer. So I'm on my cell phone. Sorry for the technical glitches, everybody. And sorry, India, for kind of bailing on you.
No worries, things happen.
So great. I'm glad you guys just got right into it. And Oliver, I think you were just talking about the kind of general fertility trends. And I am curious, just kind of picking up on what India was saying. How have you, Oliver, how has COVID affected consumer awareness around fertility? I mean, it seems like people's priorities may have shifted, but I'm curious as to your scientific view on this one.
Yeah, so fertility has never been kind of a more exciting topic. At Mate Fertility, we're focused on affordable and accessible fertility treatment. Our clinics are typically 40% less expensive than the legacy clinics in major markets. And we're focused on kind of putting affordable and accessible fertility clinics in more tier 2 markets that we've identified as kind of fertility deserts all across the country. So in terms of kind of how the pandemic has just exploded the need, people are just talking about infertility more than ever, right? I think couples have, really kind of looked at their life, looked at the status quo, looked at what's going on, spent a lot of time working from home, and now more than ever, they've kind of made the decision to go all in on their career, which, could be why fertility preservation numbers are up, or also kind of discovered, hey, we really want to start a family and we're having some infertility, problems. So we've got to see a specialist on that.
Yeah. It does seem like a time, I mean, obviously I think for many obvious reasons, it's a time when people are more focused on their health generally. And fertility is obviously one really incredibly important component of healthcare and people's personal health and their personal journey. I'm curious, Dr. Kamite, what themes have you seen coming up in your kind of care universe? I mean, you've been in precision medicine for 20 years, 20 plus years. What types of themes are you seeing coming up in your practice and with your patients? What are people focused on?
Well, I think what COVID brought to light was the fact that if you were healthy, you actually did much better. And the notion, two themes that were so clear cut. One is the comorbidities really put you at much higher risk with COVID, and our work in precision medicine, looking beneath the surface and connecting the dots about precision data, looking beyond just the usual routine labs, but rather at biomarkers, specific biomarkers that were able to detect and predict disease and reverse it, and literally reverse aging at the genomic level. So if you think of chronological aging versus genomic labeling, we can detect your health trajectory. And so none of our patients, who we call clients because we don't want them sick, actually went to the hospital with COVID. And only recently, one such client who did not want to be vaccinated and let us know a little late in his course, ended up in the hospital, but not on a respirator. And so we were very proud of that. We are interested in doing that at a very low cost online through digital health, and raised $5 million in a seed note, and now we're doing a Series A, because I believe this should be for everybody in the world, because medicine is mostly reactive instead of proactive. The other theme, I think, is telehealth. We've been doing that a long time because we look at data, we connect the dots, and I thought lots of doctors did that. It turns out that my ability to look at numbers and how they connect is AI. So we've been lucky enough to work with the chief scientific officer who took the data in about 100 people over a year and said that they all fall into, the patterns are actually predictive. So it's quite exciting, and we're analyzing data, longitudinal data. The way I designed looking at people longitudinally is N of 1 instead of the way population data is collected. So it was really an eye-opener. So we are very busy, but it's intense, but it's exciting. So I'm happy to share that with anybody here, either now or after the call, more likely.
Yeah, no, that's fantastic. And I think, capturing, there's so much data we can capture nowadays, healthcare data that we can use proactively and preventatively to protect our health and our immunity. And Lee, I'm curious, we talked on our pre-call about some of the really interesting user acquisition experiences your company has had over the pandemic. Can you talk a little bit about, how these things are coming up for Vessel?
Yeah, absolutely. So it's been interesting because when COVID happened, like for everyone, there's obviously a lot of loss and difficult things, and we're super mindful of what everyone's going through, been through. But it did give us at Vessel the chance to put more results about what's going on in people's bodies in their hands much faster. So it was interesting. We initially sold out of cards. We got literally, I think within 17 days, we'd sold 104,000 cards. And then, that's a silver lining, you might say. But then what happened as COVID really hit, it impacted our manufacturing facility. So we had to pivot, scale down, scale up when they'd kind of got things fixed. there were some issues there because obviously they were going through their own stuff at that third-party manufacturing facility. But what we ended up doing is the in-house science team for Vessel is in Pennsylvania, and they ended up kind of putting a production line in place there with a partner closer to them. So it was a pivot, it was a change. We saw what was happening. We didn't want to let the customers down that had placed orders. So yeah, and the customers were super understanding, very fair about what they'd see. They realized what was happening. So on a production capacity, that was what we kind of learned from that, is you just got to pivot and be ready. The other interesting stuff that we learned is, and I guess a lot of people in the world doing this, is like having a lot of talent that isn't based. We're in San Diego and LA, being able to have the option to have talent that's placed all over the place. We're I think 57 people now, and we're across I think 24 different cities, and we love having those people that are, we've got we've got an amazing team, best in class talent, and it doesn't matter where they are now. Like everyone's just where they need to be. So yeah, it's been an amazing 18 months, and I think we're excited now that, as hopefully, bearing in mind the Delta variant, we're going to be able to ramp up production again in the next few months.
Yeah, I love that segue into the kind of operational silver linings, if you will. I mean, I think a lot of our clients across various industries are finding better talent in other places, and experiencing some of the positives of a distributed workforce, during COVID. I'm curious how you all have managed through utilizing people who are in different places. I mean, how do you find that talent? How do you train them? How do you build a company culture around that? I mean, Oliver, I know Mate Fertility opened its first clinic during COVID. Maybe you can talk a little bit about how you guys have approached this issue.
Yeah, so Mate Fertility has been, I think in our entire company's life cycle, we probably spent 3 months with a dedicated team in the office. We really started the company January of 2019, and the pandemic hit kind of Q2. So we've been virtual really since the beginning of the company. We've been virtual when we've scaled. We're at about, close to 24 people right now. So the company is growing. We're opening clinics, and we're doing it all remotely. It's really allowed us to hire just the best talent anywhere in the country. So for us, it really doesn't matter where they are. If they can be on Slack and they can jump on Zoom, and now a lot of our roles do have travel required, and they can travel, we want the best people inside of our organization. So I think it's really opened up the hiring pool for us.
Mm-hmm, mm-hmm. And I know culture is very important to your business. I mean, I know a lot about some of these companies just because we work together, and I'm just curious, how do you instill culture in a distributed workforce?
Yeah, for sure. I mean, culture is so important, and we've got to make sure that our team is, on the right seat, in the right bus, moving in the right direction, every single day. And I think for us, it really comes down to having the right people in the organization. It's incredibly challenging to micromanage anyone, specifically in a healthcare company. I think it's even, running a business remotely has made it impossible. So for us, it really comes down to, doing an extensive interview process. I mean, our interview process has gotten, from my last businesses, it's gotten significantly more intense. I would say a typical person that we hire at Mate Fertility is going for at least three to four interviews, reference calls, reference checks. And we've also started implementing projects, which is something that I never did before. So before we hire anyone, we give them a fairly kind of easy to understand project. And again, we've had candidates that go, hey, I'm not going to do the project. And we go, well, you're probably not the right fit for the organization. We really appreciate your time. Doing that project has allowed us to really hire the right people, because if they're willing to do the project and they do a good job on the project, it shows that they really want this job. They really believe in the company. They believe in the mission vision, and they're going to be a great fit.
Mm-hmm, mm-hmm. Yeah. Fantastic. So I'd love to talk about product launches and, kind of customer acquisition during COVID. Dr. Kamite, how are you, specifically at Grok Health, how are you thinking about, expanding access to precision medicine through your app, and how are you reaching your end users?
So we have several ways that we're doing that. First of all, we're lucky enough within the center to have decision makers in various companies that are very excited about being able to offer the app to their employee base. So it's not going to go through a typical self-insured mechanism where they have insurance ties to it, but rather more like a benefit package. The price has not been set yet, but it will be quite low compared to what the center costs, which is a bespoke method. And for the full system, here it will be more ramping up. So there will be a number of diagnostic markers along with what we think is the critical aspects of somebody's health story. And then change will be automated, what we call automated interventions over time. And as we make these interventions, we're going to look for findings that get reported back. And if you will, it'll be rinse and repeat. But also we are doing the usual online ads, and we're creating a wait list. And we're lucky enough to be known in the communities, both in New York and in Silicon Valley, so that we're garnering a fair amount of attention bringing this to the population, because it's the first time that there's proof of concept and long-term data that proves that we reverse disease. We first identify it well before people are really aware of symptoms of diabetes or heart disease or even identifying cancer. So bringing proof of concept data that has scientific evidence to digital health and then being able to offer it at remarkably low prices, I think is going to be a unique proposition. Most of what's out there, it's great, like with Livongo and a number of other management tools, but most is really targeting chronic disease, because most of our $3.8 trillion budget is handling chronic disease and end of life. We really hope to end chronic disease in this century, or start with that, because I think by detecting it and giving people tools direct to the end user, we hopefully will make a difference, because that's not what medicine's about. Medicine's about reaction, not proactive kind of identification of a health trajectory, and having the end user or a human being own that knowledge base. And we see it in metabolism, in the way people make choices. Fasting, for example, as food is not right for everybody. Measuring sugar doesn't really tell you enough about a person's makeup. And a lot of it is buried under the surface. So getting that information should be extremely useful.
Mm-hmm, mm-hmm. Yeah, absolutely. What about you, Oliver? How are you all thinking about user acquisition, or I shouldn't say user acquisition, but how are you thinking about getting to the people who are curious about fertility or are needing to explore more systematically a fertility solution? Obviously you provide services in person, but also, via a virtual care or telemedicine platform. So I'm just interested to hear how you guys are thinking about reaching patients.
Yeah, for sure. Really good question. So I come from the world of kind of consumer, all things consumer. That's where I spent the majority of my career. I've been in women's health for the last 5 years, where we founded a business called Queen V, which was recently acquired by Reckitt Benckiser. So all I know is kind of CAC to LTV ratio. It's just kind of in my blood. In terms of how we acquire new patients at Mate Fertility, we have kind of an unfair advantage in that we partner with local market physicians to kind of be the anchor local market partner. So they have kind of an existing patient base that already has infertility issues. So it's a very kind of, seamless self-referral strategy. So a lot of our patients come from self-referral. We also kind of win where it matters. A lot of, fertility treatment specifically is a very intent-based search, right? So for us, we really don't waste money on Facebook or Instagram or TikTok or any of those platforms. We spend most of our marketing dollars on Google, because Google is where the patient's going when it's an intent-based search. We'll then put a pixel on the patient. And again, they're not a patient yet, so they're still a prospective patient. So we're following all the HIPAA rules and regulations. We'll put a pixel on them, and then we'll potentially retarget them programmatically. We'll potentially retarget them on Facebook and Instagram. And I think we have an unfair advantage in that we do all of our performance marketing in-house. We don't outsource it to any agency. And then we also, focus a lot on just being part of the community and provider referrals. Yesterday at our Oklahoma City clinic, we did a procedure with the local weather girl who's like beloved in the community in Oklahoma City. And that's gotten us hundreds of Instagram followers and lots of, patients calling in about their own infertility journey. So it's really being part of that community to kind of get, other provider referrals or just kind of becoming known in the community. That's why we launched the business in Oklahoma City, because we really wanted to kind of use that to understand best practices as we put clinics throughout the country.
Very cool. Lee, I'm curious, because you mentioned that you had such a spike in interest in your product around COVID. How are you empowering users to turn the data that you're providing them with into kind of actionable insights? And like, what is the next step once you've, provided the user with that health data? What do they do next, and how are you empowering them to take charge of their health?
So once they've taken, they get data immediately. As soon as they take one test, they get kind of a wellness score. So you could be high, medium, low in cortisol, magnesium, ketones, vitamins, etc. Once they've taken 2, 3, or 4, then it really gets interesting because they can start to track where they're at. So out of 100, let's say I take one test and I'm 60. And I don't know, my cortisol's high. We do the test first thing in the morning. So as soon as you wake up, you're stumbling around, you get to the bathroom, you take the test. Once you've done 2, 3, or 4, it really gets interesting, and that's where you start to track it. And the way that the app works is it will, for your body, what's going on in your biomarkers, it will say these are the foods that can help get your levels back. It'll even recommend exercise, yoga, the obvious stuff we probably all should be doing, but it will give you these reminders, bring certain scores down or up as needed. So we recommend exercise, yoga, and then there's food. And we also have Vessel Fuel, which is our own vitamin and supplement kind of choice. And you can what's really interesting is you can actually add in exactly what your body needs into one capsule as you go. So if you're low in, different things, you're not sleeping great, it will automatically add magnesium and the other nutrients you need. And within 4 to 5 days, everything comes. Again, you do the exercise, you take the supplement, and your score starts to go up. So it's pretty simple flow. And we just added live nutrition about 3 weeks ago, which has sent usage through the roof. So these are actual qualified licensed nutritionists. You get a free 15-minute onboarding, and we've seen huge feedback about how much people like to get that knowledge.
Fantastic. Oliver, it's interesting because I think, Dr. Kamite, Lee, they're focused on preventative care. I expect there's probably a fair amount of comorbidity in the infertility space. Does MATE spend time thinking more holistically about patient needs kind of outside of the clinic, or how, patients can optimize their health to perhaps maybe indirectly have an impact on their fertility? Or like what component of care does that comprise for MATE fertility?
So we really rely on our clinical team to make the appropriate kind of treatment plans for the patient. Right now, we have preferred partners in terms of therapy, acupuncture, massage, things like that. But we really focus on IVF. IVF is proven, IVF works, and it's what we do every single day. It's 90+% of our cases that we see. When patients come to us, it's because they've been trying for a really long time and they've been unsuccessful. So most of the time, IVF is the best solution to help create a family.
Absolutely. Cool. Well, let's see. I would love to open it up. I got a message from Taylor that we can actually go all the way up to 1 p.m. If people have questions for our panelists and they want to populate questions into the chat, I'm happy to, kind of open it up to the room, so to speak. But in the meantime, while we're waiting for some of those questions to come in, and it looks like we may have lost Dr. Komite. Lee and Oliver, maybe you can talk a little bit more about some of the operational silver linings that you've experienced as your business has expanded during COVID. I mean, Lee, I'd love to hear a little bit more from you about how you turned the challenges into opportunities.
I think something that Oliver said, which really hit home to me as well, is, he spoke about Slack, is our COO, Christian, who's one of the best COOs I've ever worked with, he's made the company kind of live and die by Asana. So, getting the OKRs, locking them in. I mean, I know that most companies these days use one of those, Monday Asana, whatever it is. But I've got a meeting at 1 today, and it's to go through one specific OKR. So everybody being distributed, we've got the best talent, but to really stay laser focused on what the business needs to deliver and not lose time, not lose track. It's the best use of Asana I've ever seen. So that and the use of Slack has been phenomenal, just helping us keep on top of stuff. And again, like Oliver said, I think be a Christian, we have a playbook that we actually kind of use to, it's kind of our mantra. It's how we kind of live and work and breathe in the company. So everything from, as Oliver said, like, the way we hire people, are they a culture fit? And sometimes, we all know you can get a close hire where you're like, oh, they'd be an amazing hire. But if 2 or 3 of us are just like, they're amazing, but there's something not quite there, just being open, then we really trust our gut and we say everyone's got to be fully on board. And that's, and again, I used to be at Google, and the hiring stuff there is bananas. People, the average is like 7 or 8 interviews. So I think that being instilled into what we do at Vessel and the playbook that we use is a really good marker for how we kind of operate.
Mm-hmm, mm-hmm. Yeah, the old mantra that I always heard was fire fast, hire slow. Sometimes that's really hard to do in the startup universe because you find a resume that's good and you want to jump on it, but culture is so critically important as you're growing an organization as quickly as you are. What about you, Oliver? Any other tips or tools that your team has really relied on in this virtual universe when you're scaling team and pivoting strategy?
Yeah, I mean, I've been operating companies for quite some time now, so I've got my fair share of battle wounds for sure. I used to hire fast, and fire fast, I guess. For us, we haven't had any turnover whatsoever. We haven't fired a single employee in the last nearly 18 to 24 months. We haven't had any turnover, no employee quit, and we haven't terminated anyone. And I would say that is because we hire slower than I've ever hired before in any company I've ever worked with and run. And our kind of chief people officer has really focused on ensuring that every person is just the right fit across the entire organization. So I think that is so much more important now when you're in kind of this, remote world, because it's impossible to assume that everyone is you can't micromanage in this world. It's very hard to see kind of productivity levels. So for us, it's really like, is this person the right person? And do we actually think they're going to work hard?
Mm-hmm. Mm-hmm. How are you thinking about geographical expansion? As the hopefully, fingers crossed, Delta variant accommodates us and doesn't continue on the current trajectory. But I know you have a big geographical expansion plan. How are you thinking about that?
For us, I mean, we've identified hundreds of markets that we kind of call fertility deserts. We think the industry at scale, but we just focus on infertility care. We are completely uber focused on infertility treatment. We believe that at scale, the US should be tracking at kind of 1 clinic per 50,000 people. Today, the US is closer to 1 clinic per 900,000 people. We've kind of focused our attention on markets where, it's 1 clinic per 250,000 people. I mean, just this morning, we were spending a lot of time with our real estate team, looking at the state of Iowa. That's a market that we're really excited about. We're opening 2 more clinics in and around the Oklahoma City area. So we're really trying to just kind of win these fertility desert markets where we can make an impact. And it's also kind of non-competitive for us, right? We're going in where there's so little supply, so little demand, we can win the market, almost immediately.
Mm-hmm. And Lee, for Vessel, I mean, you were talking about some of the really interesting product extensions that you all have gone into to kind of support, outcomes based on the data that you're serving up. What are you guys thinking about for the future? What's next for Vessel?
That's that's where it gets really interesting. So we, John and Matt, our two founders, have actually made contact with somebody in Europe. It's a little bit hush hush, but they think they may have an early urinalysis test for pre-cancer. So for us, the wellness card is, fairly, it's a great start, right? Magnesium, cortisol, it's amazing. But, we see things like next products being like an athlete card, or a female wanting to get pregnant card, like so folic acid, all these different things. So there'll be other products, in good time, when we're ready, when the tests are accurate, the efficacy is good. But yeah, for us, it's interesting. Dr. Cometi mentioned about, preserving life and finding disease earlier. That's also for us. We talk about, reducing human escape velocity. Like really extending life, making life quality even later on in life. That's our end goal. So these first tests are just it's a great question, kind of a drop in the ocean. Later on, I think there's going to be so many more cards and like really crazy tests that we're going to create. So yeah, I think probably 1 to 3 years is going to like really open up the next set of cards.
That's really exciting.
Yep.
That's great. Well, it looks like we've got about 5 minutes left, so maybe time for just a couple more questions. Would love to take a minute to talk about fundraising and changes, challenges, opportunities during this really strange time of quarantine. I mean, our venture capital practice has never been busier through COVID. So the sense from my vantage point is that we haven't had trouble getting deals done, but I would love to hear what your experiences have been like if you have fundraised during COVID and what that experience was like. Maybe we can start with you, Oliver.
Yeah, so Sarah, you see our deal flow, so you know how busy we have been on the fundraising side. So yeah, I mean, we raised our pre-seed round out of COVID. We raised our seed round in the middle of COVID. We had, quite a few term sheets on the table for the seed round. We got to pick our partner. We got to pick the amount of money we raised. And now we've been fundraising for our Series A for the last 3 weeks or so. And, that should be announced kind of publicly in the next 4 to 5 weeks. That process has been incredible. Having done this before, I love sitting in front of my computer and doing management presentations, in 30 to 45 minute increments. It's the world's greatest pitch fest. And I find it to just be a great use of time. You get straight to the point. I think previously, fundraising outside of COVID, we would maybe, really set the stage for the pitch meeting. We'd send some materials ahead of time. Today, we kind of get straight. If they're taking a pitch with us, we assume they're interested. We pretty much send them the data room. And this has, allowed us to really move through the process incredibly quickly. We will go from pitch to signed term sheet in about a 4-week period for Series A, because we've really scheduled the process out and we've just been very efficient, very direct, and had all of our materials buttoned up going into this fundraise.
Mm-hmm. So just really trimming out all the fat. How about on your side, Lee, with Vessel? Any kind of efficiencies or learnings on the fundraising front during the pandemic?
Yeah, it was like Oliver said, it's been pretty hectic. We raised a pretty large seed, actually. We raised $14.5 million seed, which I know is a big one. We're doing a bridge right now because we kind of want to get some more data in from the next set of card users. So probably Q1, Q2 next year, we'll do our Series A, which will be probably $20 to $30 million raise. We were oversubscribed on our seed. Monogram partners came in. They were amazing. They're such a bright group. And then we had a couple of family offices that are in this space as well. And yeah, we've just seen great appetite. I think people are just really interested in kind of what we said earlier, like they want to see what the next tests are coming. And because of COVID and what's happened, we say we want a lab in every hand by 2028 or something like that, because having these results, and I mean, it's literally scan it in 4 minutes, everything in your hand. It's like everything. It's like computers. It used to be a big mainframe. Now this is a computer. We think the same with when people want results and information about the body. They want a lab in their hand. So that's our goal.
Incredible. Well, let me just go ahead, and I think our next panel is lined up. So I want to thank the panelists for joining us. Oliver Bogner from Mate Fertility, Lee from Vessel, and Dr. Comite from Grok Health. Thank you all very much for joining us. It was such an interesting conversation and we really appreciate your time.
Thank you.